I'm just incredibly humble and thankful to be able to be here today. I want to first off just start by saying that I am not a neurologist. So I'm here, the cat with a little mask. I'm not pretending to be a neurologist. I do a different job. I'm a clinical geneticist. And what is that? A lot of people don't know what I do as a clinical geneticist. How I think clinical genetics is traditionally described is we try and understand why an individual has a condition and then tries to be an explainer when we've got a why, or explain also what the journey is towards trying to understand. But I would love for it not to just stop there, and I think that we also have a role as part of a team, in this particular case the fantastic expertise of the neurologists here, to try and make this journey for you more understandable and something that we can work on together. So I am very much speaking on behalf of a group of people. I did come from Sydney. My research has been based largely at University of New South Wales, where I have a fantastic team of people that I work with from the clinical genetics department. So Rani and Beck, I think, may be known to some of you, from the neurology department. So that's just not fantastic neurologists like Annie Bai and Tej, but also we have Fleur, who works on from the psychology aspect and the information provision, and Erin, who is an amazing clinical nurse consultant. And then we've got very, very lucky to have Suzanne, who's part of our team. She's got a psychology background, and I'm very proud to say she's now moved from being our project officer to being a PhD student and taking on some of the research that we would like to do. And just a quick background of our study. You've been hearing about these, and we're just a little mini study compared to Boston and amazing groups internationally. What we've done is we took a group of patients from Sydney Children's Hospital. We did exome sequencing, and we found we did that in the background of a health economics study, because we were trying to prove that using new genetic technology was cost effective as part of a story to go to the government. We've moved in the last part of my PhD to whole genome sequencing and improving diagnostic yield, and we've described some genetic conditions along that path. But that's all to the thanks of the families that we work with so closely. And really, part of what our next area we're looking at is, okay, if we have a diagnosis, how can we make that more meaningful? How can we actually move from the genetic diagnosis on the test report to something that makes a difference to people's lives? So we held our first little local family day, which is not a tool on this level, but a means of trying to get another route for families who couldn't maybe come across to Melbourne, and also as a way of connecting families, because I think what we've been hearing from the talks today is how important it is to know that you're not alone and to connect up in any way that you can. So we're very, very pleased that that's the way that we want to do. One of the things that members of our group have been working on is a website, so Penn New South Wales, which is about supporting families with a whole range of different types of epilepsies. And one of the aims is that we're going to put some genetic information on there. So just speaking locally, and every different hospital, even within a hospital, has different processes. What we tend to do at Sydney Kids is that primarily the neurologist is who is thinking, could it be important to come and think about genetics? And then if that's the answer yes for that family at that particular point in time, then the genetics team comes in to try and help explain the genetic testing process, offer support through, hopefully get a result that then is fed back, and with the neurology team leads to improved management and support. So this is the kind of ideal of what we've been talking about. Catherine next is going to be talking about translating the genetic test result to treatments and therapies, and this is really what I was going to focus on today, is about how it moves to supported information. But this is the reality of my life, is often there is no relevant, up-to-date information, as we've heard. Often people are dealing with very individually rare conditions. And so this can be the situation. You know, I tell a parent, your child has rhubarb cluster disease. I don't know anything about that condition. There's no support group. There's no known treatment. There's only 10 children in the world with that condition. So, humbling. Or I don't even know whether your child has that condition or not, because I don't know whether the genetic test result has given me enough support to say your child definitely has rhubarb custard disease, or the test hasn't found anything yet. So this is the reality. And I think, early on we were talking about who's got a gene name. Probably about half the people in the room didn't have a gene name. And that's a very difficult place to be. So what I was going to do in this talk is just give some highlights of some resources that I know about that are out there, because that was a question that was coming up, and then some information on some of our local research. So resources that are already available. Focusing on genetics, a big movement over the last couple of years has been the Australian Genomics Health Alliance. And Ingrid has led the epileptic encephalopathy flagship from that, and there are other rare disease groups within that. But part of that is trying to make genomics more understandable for people. So there's a new website that's come out, genomicsinfo.org, where they're trying to do nice infographics that demystifies some of the very confusing thing that we talk about when we talk about genes and conditions. So part of me is reluctant to put up websites because who has the time? But if you do have some time when you're waiting in EEG or in ICU and you wanted to look at this and find out some more information, that's a good place to start. And goodness, America leads the way, so the Genetics Home Reference is a fantastic resource, and that you can go in and look at things that are of particular interest to you. Genetic testing, you may detect from my accent, I'm English. So Australian Genomics, the ARGO, or Australian Genomics Health Alliance, is doing what other groups are doing internationally, and sometimes you might find that it's explained a bit better in another website. So there's also, I'll put the Genomics England website up there that talks through quite a lot of the technical details about genome sequencing. And your genetic service. This is what a genetic service and some fantastic neurologists can do as well, is just simplify all that down. This fantastic analogy from Steve about explaining how sodium channels work in ways that make sense to you and at that point in time. So genomic testing is basically gene testing, not just looking at the speaking bits of the genes that make proteins, but all the rest of our genetic code. That's a huge amount of data, and it gives you different possible results from testing. And I was just going to talk those through step by step, just to give you some idea of where you can go from that, because these are some of the questions, again, that were coming up. So for a lot of people, they get a genetic test result back, and it's not sure. It's found a variant of uncertain significance, which means we've found something, but we're not sure that's the cause for your child, or the test hasn't found anything that we can hang our hat on. And that's for up to half of children, as we've been hearing today. So maybe that's because there is a genetic condition, but our analysis is not yet good enough to pick it up. So what's clearly coming out from the research and like the Epilepsy Genetics Initiative has shown that there's a value to going back and looking at the test in the view of how the literature and our knowledge has moved along, so reanalysis. So this is an analogy I give here of this little dog in a Ferrari, I think. I'm not good on cars. So think of the Ferrari as the genetic test, and we're the kind of the dog. So we got this fancy test, but we don't know how to get all the answers out of it yet. But we're doing it, and it's a process. So we can go back to genetic tests with certain types of genetic tests and re-look at them, and that's definitely got a value. So this was just an example from one of our families. So it's a girl who, just to give you a timeline, and this will probably ring true for a lot of you, 6 years, she still doesn't have a diagnosis. We look at a gene panel, we look at exome sequencing. There's a possible change that might cause something to do with epilepsy because there's some mice that when you change that gene, something a little bit odd's happening. Scientists need to do more work. That's another 2 or 3 years. International collaborations to find more patients, and then a paper gets published. So then we get a genetic test result back for that family, but we don't know what it means for the long term because they're the only one of 4 children with that. And so then one of the things we've been trying to do is to put some information out there at that very early stage on a website called Human Disease Gene, and there's lots of different genes on that to try and get some of that early information about a gene where there's only 1 or 2 papers. And then what happens is there's a snowball effect. As you heard from before, you can go from no diagnosis in a year to suddenly 25 children around the world and getting information really quickly. The next stage, as I said, uncertain or no diagnosis, what next? maybe think about, was the test that your child had the most effective test that's possible? So is it possible, and ask questions of your doctors to think about retesting. Would that be helpful? So we've got lots of different ways of looking at genes, and here I've got the analogy of the little car. So that's a little bit like looking, at the gene panel, or have we got a big van that's looking at all of the genomic information? And it's very complicated, and this is where going back to those genetics websites can be very helpful, because they can demystify that and take it through what test has your child had, what can it do, what can it not do. But there's no one ideal test for every individual. But one of the things that is very helpful for us is that tests like exome sequencing and whole genome sequencing, we can go back and do that reanalysis, because it's looking at a huge number of genes. But the fanciest test is not always the best test. In fact, very important work done here has shown that if you actually know what the diagnosis is, then probably looking in depth at that particular gene is the best thing you can do. So it's this balance, and having experts that speak your language and know about your child is the most important. But we firmly believe that this should be accessible for everyone in Australia. And Ingrid and Catherine and lots of people in this room have been doing a lot of work to trying to get a Medicare item for the best type of genetic test. Or, and this was mentioned as well briefly earlier, perhaps the condition is not genetic, or it's more complicated. So maybe, and then, as I would say, think about research, because there's amazing teams, if you've heard, in this country and internationally, that are thinking outside the box. So possibly there's a genetic change, but it's not in all of the cells of your child's body. Maybe it's confined to a few cells within the brain, and very, very specialist testing might be required for that. Or maybe it's even more complicated than that. Maybe it's genetic changes in a few genes coming together in your child, or some interaction with the environment. And the first amazing talk you heard today just touched on that and some of that complexity, how much we don't know. But if you do have a diagnosis for your child, then what next? Well, amazingly, you guys have put together some incredible resources, and I've just picked a few, so please don't, there's no message here. I just did a Google search of some of the genes that are mentioned here, and I had to mention CLCN4 because that's a gene I'm very fond of, but we only have 6 families on the Facebook group, so we're starting early on. But there's also, it was mentioned today, some international genetic epilepsy resources from the Epilepsy Foundation, from the International League about Epilepsy, and those are great starting points, and my understanding is they will be populated more and more with resources. So this is the sort of information you can get from the ALE, and it goes through different genes and information about more of the genes. I like this particular website, which takes a more blog approach, and I think one of the really important things is that not every source of information will suit everyone, so it's often finding things that make sense to you. So this can go through some of the genes, but also they're building up more information. For ultra-rare conditions, like I mentioned that condition before where we gave the diagnosis to the family, but they were 1 of 4, then maybe going to some of the general genetic resources are great. So the Genetics Home Reference has got information on individual genes, and then links to different types of information. So mentioned that, you can go on individual genes. There's also expert reviews, something called gene reviews, which is where you have a diagnosis. That's often very helpful for the doctor, your GP, your physician who might not know much about that condition. It gives a beautiful summary. This is how it's diagnosed. These are the main management points. And they're written by experts. So here is one written by an expert in this room. So, they're really great resources for your family doctor, for your neurologist, for your physician that doesn't know about your child's condition. Interestingly, things change really rapidly, and the last time I looked at this, it's also got a connection to information about precision medicine. Is there any information for your child for that gene regarding clinical precision medicine or management guidelines? So maybe you're getting the impression there's a lot of resources out there. I'm very happy to share all these links, but they're also all a work in process, and they do slightly different things, and it can be a bit overwhelming. I mentioned those for very rare genes that I've personally been involved with. So this is from Holland and from France. And also, one of the organisations I love is Unique, because what they do is they translate some of that medical literature into stories about individual children. So giving some examples, some pictures of a child, which if you've got a new diagnosis can be a lot easier to deal with than just reading medical text. So moving on to our local research, I think this is one of the comments that I found very humbling. It's one thing to do the full genome test and get the results. That's almost like step one. And in some ways, it's almost like it's completely valueless unless you've got a body of information that you can wrap around that. So I mentioned Suzanne Nevin, and these slides are hers. So she is now moving into her PhD, which is basically looking at co-development of education and support resources for families with severe early onset epilepsy, and she's in the first year of that. So I've put up Suzanne's email there, and just briefly I'm going to talk about the first part of her project. So when there's co-design, what does that mean? In a very simple way, it's getting people with lived experience of a condition, so parents of a child with a severe epilepsy, getting professional expertise. In our case with Suzanne, it's psychologists, neurologists, clinical geneticists, working together to say, what is the problem? Lack of information, difficulty finding information, how can we fix it? Trying to fix it, and then seeing if it's working. That's it in a nutshell. So, as I mentioned, we were very humbled to have our very first local genetic epilepsy day. And I think one of the themes that I keep on hearing again and again is how important it is to know that you are not the only person facing this, and the connection and how valuable that is. So Danny and Danny came and spoke, and that was wonderful. I also wanted to reflect that many people today have talked about the impact on their siblings. So one of the studies that we're supporting is a local study looking at that in more detail. So how can we better address the needs of the siblings in the family? For Suzanne's first part of her study, what she's doing is just talking to you, which sounds very simple, but it's really an opportunity to try and hear from you what you need, rather than us saying what you need. And this is some of the reflections that have come back. So families have said that they would like information in a range of styles and formats. So, for example, one person might want a take-home pamphlet, one person might want a video. And often what's emphasised is during a clinic appointment, you've waited for a long time, get into the clinic, and then you're not actually hearing what's coming. And so having something to take away that makes sense afterwards can be very helpful. So this is a nice quote. I thought, I love a good pamphlet or a brochure or something like that you can quickly refer to, especially that you could give to someone else if you were struggling to describe what was wrong yourself, because that's what I found difficult, trying to describe it to other people. So I think that, that's something, it's bringing everyone along with you, your GP, your school. Information that's simple, understandable, but specific, not too generic. So I've read the information so many times, but it's so hard to actually comprehend because it's like so on a cellular level. I feel like I need to do a degree to fully understand it. I've tried to read up on what I could on it, but it's quite generic information, and then we already knew that. Then, other than that, there's only just very scientific documents, which I don't understand anyway. So I did have a look, but there's not much really there to look at. So I think that's something that often comes out, is there's some very generic information, or there's the very in-depth scientific journals, and can we find something in the middle? And again, something that you've all told me today, this fear that if I'm not spending all night looking up on the internet and going to conferences and reading the article and badgering my doctor, that I might miss that golden opportunity. So people are saying they want expert information that's continually updated, to take away that self-searching. So what I wouldn't like to happen, this is a father says, say for instance, is we're told, come back in 5 years' time, and we do that, and then we find out that 3 years ago they came up with this one drug that could target her seizures. So I think that's a reflection, it's amazing to hear about these advances, but goodness, we don't want to miss out on that opportunity. But wouldn't it be nice if we could be taken along on that journey? Which is what you get when you get expert people, but not everyone has the access to that. And personal support and connection. So how important is that parents feel that their treating teams are working with them in partnership and that there's personal contact. So this was some reflections on the role of a particular person in our team. X would call me probably every 3 days just to check in, see how we're doing. Did I have any questions? Having that sort of support, especially when parents are getting their diagnosis for their child and first getting all the information, just having someone check in. So you don't feel alone and lost, feel like you're floating in a sea of information and you don't know what to do with it. And what you guys are doing, you're building a community for each other. So I think just go out there and find, not necessarily just people who've got the same diagnosis as you, go out there and find people who are already running their marathon. Find out what they're doing and get connected. You feel so much more empowered if you know what's out there and that you can do. There are so many groups out there who love and support your kids as much as you do. So learning from each other as a community, being heard. So to summarise, I hope I've shown you that there are many wonderful information and support resources already available, but many of you have identified also there's some gaps, and part of that is just easily finding that information. You know, going to one place and knowing I will link to that. And you deserve that. You deserve the highest quality information that's up to date, expert, understandable and relevant to your child. And how important it is to have partnerships. So I really wanted to thank the local team, who it is all of their work and all of their support. We have some funding, but also very much to thank you for the opportunity, to Ingrid, to Catherine for allowing me to come today and talk about our little group, and to you for letting us listen. So thanks again.
Do we have any questions? Just looking around the room. Yeah, we got a few. Going once? No? Does anybody have any? You were very comprehensive. We have one over here.
Me again. How do you know if you've got in KCMQ2, a gain of function or a loss of function variant?
So do you mean how do you know from your test result?
Yes.
What it then means? So it
No,
means...
how do I know if it is or isn't? Gain or loss?
Okay.
She doesn't know if it's a gain of function or a loss of
Okay,
function
okay.
in her child's case.
So your individual child's test result needs to be looked at by an expert neurologist who knows about genetic epilepsy, and or someone that can look at the literature and say, has someone done some functional studies, i.e. looking at a cell to say, does this change, what does it do? Do we know that information for a start? And then giving that information back to you in a way that makes sense. Or we don't know what that particular change does. Is there some means that we can then get into research to understand more about that? So I very briefly mentioned, and I'd like to just mention this again, there are genes that are relatively common that we're hearing about today, but I also see families with children just have an intellectual disability or autism, not necessarily also with epilepsy. And when we start getting into that field, we're talking about thousands of genes, okay? And we can't possibly have yet the information on every single variant because we're finding new changes all the time. But working together as a community, what has been amazing is, a lot of these resources that are coming means that then people are depositing information about that variant in databases. So there's things like ClinVar or Decipher, where myself as a clinician, if I know a patient has a particular change, I can go and look, is there someone in France that's had that and they've had a particular study or paper published? And then if there isn't, and we don't know, but it would be really important to know what that's happening, because either it's going to change a child's management, or actually it's going to say whether this is the right diagnosis for your child or not. We need as a community to think of a way of doing that. So one of the things we're doing across Australia is the Australian Functional Genomics Alliance, Functional Genomics Alliance, which is talking about trying to match-make doctors who've got a patient with a particular change in a gene and a scientist in a lab that might be able to look at that. And obviously there are well-established groups in here that are looking at a lot of the channelopathies, the ion channel genes, so you're in a really strong position, but there's also so many genes that you may not know easily who's the scientist working on that. And of course, it's not just looking at that in isolation, it's then linking that up to other countries. So, for example, they're looking very closely at linking it with Canada and Japan, who are doing similar sorts of things, so that we can really move from just saying it's a change in a gene to specifically what does your child's change in that gene mean functionally, to even another level, and the background genetic information that's there, how does that influence? Okay? And I think with us all internationally working together, we will get there, because that's what's needed. As Steve's talk shown, just knowing the gene is not enough. It's knowing what the change within the gene does. And a lot of doctors don't understand that. So moving there is going to be a process, but what Ingrid was talking about in bringing us all together, that's exactly what's needed.
And speaking of that, can I just ask quickly, Ingrid, because I saw that you might have something specific on the KCNQ2, or?
I have a question.
You have a question.
But I love what you're saying. I always say the gene answer is the beginning of the answer, not the answer. Beautiful talk, thank you. I've been wrestling a little with what you said about educational resources, and some of the parents very kindly last year had a go at, I had a med student doing several simple brochures, I think what's Dravet syndrome, gait, speech, those things. But how, and I think there is room for paper things as well as online still, but how do you get that right? How do you get with one person saying, I want simple, someone else saying, I know all that, I want complex? I mean, how do we give the right level?
I'll tell you what my vision was. My vision was, I think it was around Christmas time and an advent calendar, okay? And that you might want to open up different doors at different stages in your journey, and that different people might want to open up doors. So when you first get a diagnosis or your first understanding of child's epilepsy, you might want specific information, what's the here and the now. You might not want to know about what that means for them as an adult, or what that means to their siblings, and everyone is different. And I think that's why it's impossible to say one centre in one place can answer everything for everyone. So thinking of a way using technology to provide a format that's giving people those options and a
So it's almost like you can go
navigational
deeper and
pathway.
deeper depending upon,
Do I want to open that box now? Do I want to
but then you could
that door
open
now?
the wider and then the potentially
and
or more
do I
detail.
want to know the fine detail and all the scientific information?
Right.
Or do I want the car analogy and I just want to know enough that's there? And do I want that face-to-face? Most people do. Or do I want that plus a video? Or do I want that on an app on my phone? And to me, as a simple person, it seems, is that absolutely impossible? But then I think how technology has moved on, the internet has moved on, and computer scientists.
Do you know, this is interesting as well. We'll do Chris always does a really great survey at the end of our conference, and it just occurs to me we should ask if you have a specific question around that we could throw out there to folks who in our survey, because this is a highly motivated audience. So if you can come up with some specific language, we could put that on our survey. I don't mean to be running you off. I feel like I am. You've forgotten your chocolates. We can't let you go without chocolates. But thank you very much, Dr.